the slide of the kidney. Outside here, we can see the capsule. Inside, just below the capsule, the area of the cortex, which usually contain the renal corpuscles and the proximal and convoluted tubules. And the area here, the area of the medulla, which is consists mainly of the collecting tubules and the thick portion of lobe Henle and portions of the thin Henle's loop. If we increase the magnification, this is the area of the capsule, which is the fibroelastic connective tissue. Very tough capsule. As I said in the lecture, these capsules prevent the kidney from expansion and distension during the inflammation. In the area here, we have the area of the renal corpuscle. Inside this renal corpuscle, these are the glomerulus. And you can see here a lot of profile of the proximal and distal convoluted tubules. As you can see here, these nephrons, some of them found near the area of the capsule, we call it superficial cortical nephron. Some of them found in the mid region, we call them the mid-cortical nephron, and the one that just near the middle, we call it the Juxta medullary nephron. We can see here there's some extension of the medulla into the cortex region. This we call it the medullary rays. And mostly they contain the Henle's loop, and they contain also the cortical portion of the collecting tubules. If we increase the magnification, again, this is the area of the glomerulus. This is the area of the parietal wall of the Bowman's capsule. And as I said in the lecture, this space here, we call it the Bowman's space or the urinary space. I want to increase the magnification so we can see this area here. This is the space. And this here is the cell, the simple squamous epithelium that form the parietal wall of the Bowman's capsule. Inside here consists of the blood capillaries, and the cells that found here, they are the modified podocyte. I want to increase the magnification. See here, this is the cell, the simple squamous epithelium forms the parietal wall of the Bowman's capsule. The simple squamous that we can see here, these are the modified podocyte that help in the formation of the blood-urine barrier. All we can see here, they are mostly blood capillaries, and these blood capillaries contain fenestrated endothelial cells. What we can see here, these are usually the proximal convoluted tubules, and we can differentiate it from the distal convoluted by their brush border. They are simple cuboidal with the brush border. Whereas, for example, the distal convoluted tubule, they consist of the simple cuboidal epithelium without the brush border. See here, most of the profile we can see here is the profile of the proximal convoluted tubules, and the reason for that, because the proximal convoluted tubules are longer than the distal convoluted tubules. Going to go back in magnification. You can see here these are the proximal. For example, this is the one that the distal convoluted tubule, and these are the glomerulus. This is the area of the straight tubules. As I said, they found mainly in the medullary rays. As I said, the medullary rays are extension from the medulla in the cortex region and usually contain a straight tubules. These straight tubules mostly consist of the Henle's loop, the thick portion and the thin portion. As I said in the lecture, the thick portion, which is a simple cuboidal epithelium, whereas the thin portion is the simple squamous epithelium. I will try to look at these tubules here, mostly simple cuboidal epithelium, simple cuboidal epithelium. See here. All of these tubules, the simple cuboidal epithelium, most likely they are the Henle's loop or the collecting tubules. See here these tubules, it's almost squamous epithelium. Mostly these are the thin loop or the thin portion of the Henle's loop. The second thing I talk about it in the lecture about the nephrons. As I said, if they are near the capsule in the proximal part of the cortex, we call them the superficial cortical nephron. If they are in the mid region, we call them the mid-cortical, and if they found near the junction between the cortex and medulla, we call them the juxta medullary nephrons.